Welcome to Advanced Cancer, resources to help you plan and find support, a Canadian Cancer Society webcast. This webcast is generously supported by AstraZeneca and Merck. My name is Lacey Horta. I'm a Cancer Connection specialist and the moderator of CancerConnection.ca. I'm your host. Our guest speakers are Ogechi Asagwara and Simone Stenekes from Canadian Virtual Hospice. Welcome to you both. Today we'll be discussing some of the myths of advanced cancer and palliative care, helpful resources for patients and caregivers, as well as information about planning for advanced cancer. Let's get started.
Thank you, Lacey, for that introduction. So I'm Ogechi Asagwara, and I'm here today with Simone Stenekes. We both are clinical team members of Canadian Virtual Hospice. So just getting started here, we'll first sort of talk about what Canadian Virtual Hospice is. So Canadian Virtual Hospice is an online resource. We launched in early 2004, and all of our content and information is around living with advanced illness, palliative care, loss, and grief. So Canadian Virtual Hospice is a place you can go online to access a wealth of information that is reliable, evidence-based, on living with advanced illness, palliative care, loss, and grief. The information is really for anybody who needs it. So that's for patients, for family members, for caregivers, and for professionals. But for the purposes of today's presentation, the majority of the content that we'll be reviewing and the resources that we'll sort of highlight are focused on patients and families, but by all means, healthcare providers can definitely log on our site and access a wealth of information that would support their practice as well. So the information is available in a variety of forms. There's articles, videos, workbooks, links to other reputable sites. We've got lots to offer. We're actually the largest, most comprehensive site on this topic in the world, and that's validated by a recent study by a health economist. And we're also supported by a very large and diverse clinical team and administrative staff. We have team members across Canada, including physicians, clinical nurse specialists like myself and Simone, pharmacists, ethicists, child grief experts, psychosocial specialists, etc. So we have a really large team supporting the content on the site. Our staff create content that fill information gaps in advanced cancer and palliative care. We also develop and curate and disseminate resources as well. So again, we really have a lot to offer. So sort of where we'll start is looking a little bit at palliative care. Palliative care is still fairly misunderstood by a lot of people in Canada. And so we'll sort of start with looking at 5 myths about palliative care. It's also worth mentioning that in terms of medical care and treatment for advanced cancer, it can definitely involve palliative care. And so we wanted to sort of start with a little bit of content around that. Some people may have heard of palliative care, but often they're not quite sure what it means or what it's all about, so we'll sort of get into that right now. So myth number 1, palliative care hastens death. So the fact of the matter is that palliative care does not hasten death. It provides comfort and the best quality of life from diagnosis of an advanced illness until end of life. Now looking at myth number 2. So the myth reads, palliative care is only provided in hospital. So the fact for this myth is that palliative care can actually be provided wherever the patient lives. It's really an approach to care that is meant to reach the patient wherever they are. So if they're at home, if they're in a long-term care facility, if they're at hospice, or if they're in the hospital, palliative care should really be able to be brought to them wherever they are and is not restricted by location. There's really no specific setting for palliative care. Myth number 3. Pain is part of dying. So the fact for this myth is that pain is not always a part of dying. If pain is experienced near end of life, there are many ways that this can be addressed and alleviated. There are many people with advanced cancer who do not experience pain as a symptom or manifestation of their advanced illness. And for those that do experience pain, there's absolutely medications and approaches in palliative care that can help to address this and to manage this. Myth number 4, palliative care means my doctor has given up and there is no hope for me. So the fact for this myth is that palliative care ensures the best quality of life for those who have been diagnosed with an advanced illness. Hope becomes less about cure and more about living as fully as possible. So really the focus here is managing symptoms, looking at overall well-being, and helping the individual to enjoy their life and have quality of life for however long they may have. And just looking at the last myth here, myth number 5. Taking pain medication in palliative care leads to addiction. So the fact for this myth is that keeping people comfortable often requires increasing doses of certain medications, including pain medication. And this is actually a result of tolerance to medication as the body adjusts to doses and not addiction. So people taking pain medication will likely at some point require an increase in their dose because their body becomes accustomed to the medication. And again, this is tolerance, not addiction. Pain as well can also change and shift, and therefore the medications to manage that pain would also have to be adjusted and shifted. What is palliative care? So now that we've sort of tackled some of the myths about palliative care, let's talk more about what palliative care is, and rather than what palliative care is not. So what is palliative care? Palliative care is truly a type of health care for patients and families facing life-threatening illness. Palliative care helps patients to achieve the best possible quality of life right up until the end of life. It's really a focus on the patient and the family and what their needs are and how to best support them. Palliative care focuses on treating and supporting the total patient. So not just the physical symptoms of illness, but also attention to emotional well-being, psychosocial health, and support. It looks at the best quality of life in spite of illness. When is palliative care provided? Well, palliative care can be provided at any time to anyone with advanced illness, regardless of age. Registration onto a formal palliative care program often requires some consultation with palliative care team members and may require that certain criteria are met. So who provides palliative care? Well, many healthcare providers definitely contribute to palliative care teams, and ultimately it will sort of depend on what the needs of the patient and the family are as to who might be involved in their care. So there's definitely nurses, family doctors, palliative care specialist physicians, social workers, spiritual care providers, occupational therapists, et cetera. There's usually a large team that supports palliative care, and so the needs of the patient and family will usually direct who's actually involved in their care planning. Where is palliative care provided? Well, palliative care can be provided, I think as we said a little bit earlier, anywhere. So wherever someone happens to be located for their care, whether that is at home in the community or in a personal care home or in a hospital or hospice setting, palliative care can be provided to them wherever they are. There are many formalized palliative care programs or services that provide support wherever someone is living. Really, the best place for someone to receive care is ultimately the best location that matches what their care needs are. So this is just a little bit of a visual to sort of help people capture the idea of how palliative care can be integrated into medical management and medical care. So it's a model that sort of demonstrates the shift of integrating palliative care or aspects of palliative care into overall disease management or advanced care disease management. So as traditional disease management practices become perhaps less and less, which is the blue on the model, palliative care management and palliative care approaches, which is the pink, can become more and more encompassed in the individual's care. So palliative care, using this representation, has the potential to be involved for a longer period, from diagnosis of an advanced illness, carried out ongoing from that point. And the overlap in the middle shows you where ideally someone is receiving advanced cancer management, but also their care is integrated with the concepts and approach of palliative care. This is a model that was created by Dr. Pippa Howley, a physician out of the University of British Columbia, and she's well known in the area of palliative care. And again, it's just a visual model to sort of represent how palliative care concepts can be integrated into the care of advanced cancer, particularly earlier on in that illness trajectory, as early as diagnosis. So now we'll watch a very short video clip by Dr. Susan McDonald. She's a physician out of St. John's, Newfoundland. And what this short video clip does is sort of helps to capture what the idea or the philosophy of palliative care is. After we watch this short video, I will turn it over to Simone, and she'll sort of review the next several slides. And just to let you know, this video is an example of some of the content that can be found on Canadian Virtual Hospice. This particular video is found by accessing the main orange navigation tab on our homepage that's labeled Support. You would then click on the label of the gallery, and this is where this video lives. There's also several other videos that are available that cover a range of topics on advanced illness, palliative care, loss, and grief. And so now we'll start the video.
What usually happens is that people have been told to come and see the palliative care team, or they've been told to come and see a particular doctor, and they really have very little concept about what palliative care is. They may have an idea, and it's often a negative one if they've had no experience with our service with, for example, a relative. So when I have somebody come in the room and they sit down across from me, the things that I talk to them are about what are their goals for living, and how can I help them live as best as they possibly can. Because palliative care is all about living and living well until we die. And so it includes symptom management, so the kind of physical symptoms that can come along with having an illness that will eventually take your life. But there's also the psychosocial and spiritual and emotional, financial, all sorts of different things that people experience and may have challenges with. And so when patients come to see me, I generally say, I'm here to help you live as well as you possibly can with the sickness that you have. And these are the things I can potentially help you with. But there's more than just me in the room. There's actually lots of colleagues that are part of my team, and we're all willing to help you in a variety of different ways. A small part of what we will help you with is the very last days and hours of your life, to ensure that that's as comfortable and as comforting as it possibly can be.
Great. So now this is Simone. I'm taking over from Ogechi for the next part of the presentation. And I'm going to start talking a little bit about some of the content and information that we have on the website that will be helpful to you in terms of different issues that are arising as you may be dealing with living with advanced cancer. So one of the key components of healthcare is decision-making and advanced care planning. So advanced care planning is a process of reflection and communication where the time is taken to reflect on your values and wishes, let others know what those would be and what kind of health care and personal care you'd want in the future if you are not able or capable of consenting or refusing to treatments, or any other care that might be undertaken. This content comes from a great resource called Speak Up. It's found at www.advancedcareplanning.ca. It's a national website that talks about advanced care planning and provides information on a variety of issues related to advanced care planning. One of the things that this site also has is a workbook called Speak Up. Like I said, that's sort of the whole premise of the entire website. And it provides us with a way to think about how we want to look at advanced care planning. So in the context of living with advanced cancer, or any type of advanced illness, or even not having an illness of any sort, but just really thinking about what your wishes would be for the future, there are 5 steps. The first one is to think. So think about your values, wishes, beliefs, and understanding about the care available for your cancer and your other health concerns if you might have them. Step 2 is to learn. Learn about procedures, treatment options, and the side effects. Talk about the burdens and the benefits of cancer treatment, and talk about the healthcare issues you will likely encounter. So possibly, let's say if you have a uterine cancer, you might have a bowel obstruction. That might be something that could be anticipated, and that would be something to talk about with your team. You'd also want to talk about the care needs and physical changes that might be expected in the future, and the type of decisions that you may need to make in the future, such as whether to continue chemotherapy, to consider potentially radiation in the future if you have bone metastases or your primary tumor is continuing to grow, if that would be potentially helpful or not. The third step is to decide. So decide who your decision maker or substitute decision maker will be. Some people choose to have more than one person be their substitute decision maker, so that the burden is shared amongst either their family members or friends who they know will make decisions on their behalf. Step 4 is to talk. So to talk with your substitute decision makers, to talk with your broader family and friends, and to talk with your healthcare team about what your wishes are, your goals, and the approach that you'd like to take to your care. The last step, step 5, is talking about recording your wishes. So writing down your decisions, providing a copy to those who may need it, so that would include potentially your substitute decision makers, your family, and your healthcare teams that are involved in your care. Another key aspect of looking at advanced care planning, and advanced care planning is very different depending on the province that you live in. So we also talk about healthcare directives, which is a specific document that outlines treatment decisions that a patient is asked to be followed if they become unable to communicate or make decisions about themselves. This is also often referred to as a living will, and it also is part of the advanced care planning process. Like I said, the different provinces and territories can vary very greatly in terms of the terminology that's used regarding advanced care planning. It's also, each province has different legislation and processes in terms of the types of documents that are included for advanced care planning and how the healthcare teams can approach that. So it's important that you find local information, that you consult your local healthcare team for the different types of forms or for more information about advanced care planning. Some provinces have different regions that have different information, so it's really important to look at your local information. We have, so the link that I included here, you can see, has the different provinces and territories. And that's from the Speak Up website, but also on the Canadian Virtual Hospice. When we talk about healthcare decision-making and advanced care planning, we have links to all of the different provinces as well. So I thought it might be helpful also to talk a little bit about decision-making when you have advanced cancer or if somebody you love has advanced cancer. And decisions related to palliative care situations can be approached using the following framework. First of all, we need to be informed. You and the healthcare team must be informed as possible about what is being considered and about the potential outcomes of different choices. You'll also want to find out as much as you can about what is happening with your cancer And the healthcare team has a role in helping to explore various what-if questions or scenarios with you, explaining what might be expected for each choice that's made. We also want to determine goals. So from a strong foundation of information, you can begin to explore the choices about tests, treatments, and other healthcare considerations. And this exploration should be guided by the goals that you're hoping to achieve. In a way, goals are like a lens that focuses our thinking, and the question, should I do this, may be answered with, that depends. What do you hope to achieve? We also need to avoid assumptions. Unless goals are openly and specifically discussed, we can make incorrect assumptions about the hopes and expectations of others. So when we are looking at goals, we often want to ask, whose goals are they? For most people living with terminal cancer, a time usually arises where they would not want further tests or treatments. However, if someone's not well enough to take part in discussions about care options, family members may be asked about whether they feel it is time to limit certain treatments such as antibiotics or blood transfusions, especially when death is closer. Making decisions for someone else comes with a tremendous sense of responsibility, and family members may sometimes feel as though they're deciding whether their loved one lives or dies, when in fact, this outcome has been determined by that cancer. The questions about limiting treatments in such situations are focused on how to ensure the best possible quality of life as death nears. And rather than thinking of such choices as, what do I want done for them, try asking, what would they want done? By keeping mindful of the person's goals, families can feel assured that they're making decisions that their loved one would make. This is why having discussions in advance can be particularly helpful with families. So when we're trying to determine whether goals can be achieved, there's basically 3 different types of possibilities. It might be an achievable goal. So some goals are clearly achievable under most circumstances. So using antibiotics to treat a simple infection in an otherwise healthy person is an example of a treatment that will usually achieve the hoped-for outcome of eliminating the infection. In such circumstances, when there is informed consent of the patient or a substitute decision maker, the treatment is usually provided. However, the other potential is that it's an unachievable goal. And sometimes goals are just not achievable. For example, it's not possible to restart or resuscitate someone's heart, which has stopped beating due to overwhelming shutdown of multiple body systems because of a progressive terminal condition such as cancer. When body systems can no longer support life, resuscitation won't work. In such circumstances, the treatment should not be attempted. Providing treatments that cannot possibly reach their intended outcomes is not consistent with generally accepted standards of healthcare. And the healthcare team's role is to explain the situation and explore alternative approaches with open and frank dialogue. Through such discussion, the family and the healthcare team may decide to set different goals for what they hope to achieve. Then, lastly, we have goals that might have some uncertainty. There may be uncertainty about whether the hoped-for goals are achievable or whether interventions will help as much as expected or hoped for. For example, someone may wonder if a blood transfusion will give them more energy or whether an infection will respond to antibiotic treatment. In such circumstances, it may be worthwhile to consider a time-limited trial with these parameters. First of all, clearly defined and agreed upon hoped-for outcomes. Secondly, a specified time at which to reevaluate the path taken. And thirdly, a plan for an alternative course of action if things are not unfolding as anticipated. So this approach to decision-making can be time-consuming and extremely emotionally challenging as it involves open and direct exploration of possibilities that we aren't used to talking about, which may even feel frightening. You'll need to understand the current situation, what you hope to achieve, and what options are available to you to bring about the desired result. However, by exploring these issues thoroughly before you make a decision, you actually may reduce some of the anxiety and confusion that sometimes surrounds the decision-making process. You may feel that you're more confident that the decisions you are making are the right ones for you and for your family. So in terms of decision-making, that sort of kind of sums up the information that I wanted to provide to you, but just letting you know that that information is also available online in one of our articles. Now I thought I would talk a little bit about another topic that families often struggle with, and patients themselves, about living with limited time. And we have an article by this title, and I thought I would just go through some of the information that's provided here just for you to think about, sort of from if you're living with advanced cancer, if you're a caregiver, to sort of think about some of these emotions that might be coming up and some of the ways that you're reacting to living with an advanced cancer. So the first one is disbelief and denial, and receiving bad news about your health care often leads to a sense of shock or disbelief. This feeling's like living in a bad dream, and absorbing information actually becomes quite difficult. So it's as if our whole system kind of blocks things out and tries to protect us. So denial is our own human way of protecting ourselves from an attack on our reality. And it's like wrapping ourselves up in cotton batting to try and absorb that blow. And as we become more able to face what we are experiencing, we are able to peel away some of those layers and rely less on denial. Since denial serves a purpose, it's not always helpful to try to take away someone's denial. Instead, families might consider trying to develop an understanding of each other and respect the differences in how each person is responding emotionally. Denial sometimes requires a bit of a balancing act within families and with caregivers. And never acknowledging that things are getting worse might actually lead to missed opportunities for important or meaningful conversations or the ability to access helpful care. So if you're not sure whether denial is becoming harmful, you may want to connect with a healthcare provider. And this person can help you to gain perspective on your own emotional process and perhaps facilitate communication within your family or with the healthcare team. In terms of accessing healthcare providers, most cancer facilities have access to social workers or psychologists who are more than willing to meet with patients and families to go through or discuss some of the issues that are arising as they're dealing with their advanced cancer. Another feeling that people may have is grief, and we usually think of grief in terms of family members and patients who are struggling to carry on after the death of a loved one. However, grief can be felt even without a death. Where there's loss, there's the potential for grief. And from the moment of diagnosis, and probably earlier, there is a sense of loss. So physical changes can lead to an altered body image, an increasing loss of independence, and not being able to work can be a major loss. This is especially true for people whose identity is strongly connected to their jobs. All of these losses may lead to feelings of grief. And loss of control is another type of loss. Loss of control becomes an overwhelming theme in advanced illness. And as decisions about your life are being made by others or you're losing control, can lead to anger, frustration, and at times even despair. While there are no easy answers for dealing with loss, talking about these feelings will at least give you a chance to vent and feel understood. Another couple emotions that families often talk about in patients are fear and anxiety. So for someone living with advanced cancer, fear can take many forms, and a big part of dealing with fears is naming them. Fear of the unknown is a common theme that we see with people with advanced illness. Not easy to talk about your fears, especially when you're feeling vulnerable. Most often you will find that there is information and support available to you, and reading about symptoms of illness, for example, may leave you feeling more confident about the care you will receive. Probably one of the biggest sources of anxiety for families is the sense of uncertainty, often related to how the illness will progress and when death might occur. And unfortunately, this question's not easily answered. However, anxiety can be helped by knowing what to expect. And that's where our website comes in terms of finding information about what to expect as you're living with an advanced illness. Another emotion that people have is anger, and living with a terminal illness brings many potential sources of anger. As with pretty well all emotions, the recurring theme is the importance of expressing feelings, and ideally you'll find someone who can listen and accept where you're at as opposed to trying to fix them. And some families and friends feel hopeless when they hear what you are expressing. A normal response is to try to make things better, but while our intention is to be supportive, sometimes these encouraging words may make you feel as though you're not being heard or understood. So you may begin to feel isolated. If that's the case, you might consider contacting a healthcare provider or spiritual care provider, and these people are trained to help you work on your own process to find a way to deal with what has been kind of thrown at you and not maybe sometimes unexpected ways. Guilt is another common emotion. Knowing that time is limited tends to make people reflect on the past, and sometimes reflecting on the past exposes regrets for past actions, or regrets can be connected to what hasn't been said or done. And sorting out what needs to be expressed and what you need to let go is emotional work, and sometimes this means exploring thoughts and feelings in a deeper way. Another emotion people have is hope, and feeling a sense of hope when life is cut short can be challenging. Living with a terminal illness means redefining hope. Even though none of us realistically hopes to live forever, there's always potential for hope, but sometimes the challenge is finding it. Within families, hope can be seen as something to maintain at all cost, and there's a fear that if hope is taken away, the person will give up and die more quickly. Sometimes well-meaning family members try to restrict information about the illness in order to maintain hope. While that intention is totally understandable, families and people living with the illness most often are aware of the changes in their own bodies and are sensitive to how others are reacting around them. And the biggest drawback is holding back difficult information. Is that the person who is ill may become more isolated and have nowhere to go to express their fears and concerns. And the question of isolating the patient far outweighs any benefit of that protective behavior. We also know that families need intimacy and closeness. Touch and intimacy are essential human needs that affect all of us regardless of our age, gender, and nature of the relationship. Couples who have less opportunity to hold each other may miss that physical closeness. And children also need the opportunity for close physical contact. Sometimes time alone to explore intimacy is an important aspect of end-of-life care, and finding ways to ensure privacy should be considered in any type of care setting. The last type of emotion that people will have is potentially exhaustion, and there's no roadmap showing how the last months of life for a person with advanced illness will unfold. Typically, there's a lot of ups and downs, and the unpredictability of illness can be emotionally draining for everyone, as everyone wonders what to expect next. Many patients and families that I have dealt with in my clinical role have described that time in terms of the end of life of somebody is like an emotional roller coaster. And living in this challenging time often forces us to examine our expectations and to recognize that the rules of the game have changed. And particularly as caregivers, we have a tendency to keep going without fully recognizing the demands of the situation, and we need to really give ourselves permission to take care of ourselves. Having just finished sort of that information about caregiving and caregivers needing to take time for themselves, I thought I would also highlight some of the information we have for caregivers on our website. We have different topics articles, as you can see here, talking, some of them are very practical, some of them are more emotional. We have discussion forums for caregivers, as well as several videos that highlight some of the needs that caregivers have and some really innovative ways that they may want to take time for themselves within their caregiving role. I thought it was also important to talk a little bit about the financial impact of advanced illness on patients and families. We do have two separate areas that sort of look at different aspects of financial issues. One of them is from the patient's perspective, and we have an article called Patient Benefits. It talks a little bit about some of the benefits that may be available to people across the country that people may not know about, and so it's a good article to access. It talks a little bit about the Canada Pension Plan that has a disability benefit to CPP contributors, and that has several eligibility criteria in order to get that. There are also certain provinces that have provincial palliative care benefit programs. So BC, Alberta, Saskatchewan, Manitoba, New Brunswick, and PEI have special programs within their provinces to cover the cost of medications and basic medical supplies for terminally ill people who are registered with palliative care programs. So the criteria for eligibility vary from province to province, and most of the programs require a physician or primary care provider to fill in the application form. And once again, they often also have to be registered on a palliative care program, which means that they have to meet the eligibility for those programs. Other provinces may have provincial drug programs or other health benefit programs that could be accessed. Provincial or territorial social assistance could be looked at. Employment insurance sickness benefits are available for temporary work absences. And sometimes people have employer insurance plans that may offer some compensation for some of the costs that may be accrued due to medical expenses. Some people who have life insurance may have something called a living benefit, and such a benefit allows for people who have been diagnosed with a terminal illness to have a portion of their anticipated benefit paid to them in the years before their death, and taking such benefits will reduce the amount of the insurance benefit ultimately paid to the beneficiary of the insurance. There are also tax credits. People who have costs related to health-related goods and services or additional living costs due to disability may be eligible for tax benefits, and that's something to explore as well. Again, each province and territory may have different benefits available to people. In terms of caregiver benefits, I thought I would briefly review some of the benefits that are available. Some people may have benefits through their individual employers. Some may have, there's a specific caregiver allowance in Nova Scotia that should be highlighted. And then in terms of survivor benefits, Canadian Pension Plan has survivor benefits that differ in terms of a death benefit, a survivor's pension, and a children's benefit. All of those have specific criteria that need to be met, but that would be something to be explored. Quebec has their own pension plan and therefore has other criteria than the national plan. As well, some people may be employed and have life insurance or pension from if they're a survivor after somebody has died. I also thought it was really important to highlight that on a national basis, we have something called the caregiver benefit through Canada Employment Insurance. So it's called the Compassionate Care Benefit, and it's available to Canadians who need to take time off work to care for seriously ill family members. There are specific criteria for this employment insurance benefit. It is an application process and has two forms that need to be completed, one that actually needs to be signed by a physician and one that needs to be signed by the patient. And there are lots of questions and lots of considerations to look at. So I've included the website, but if you just even Google employment insurance benefit or compassionate care benefit and Canada, it will come up as one of the key things there. There are a lot of questions that people usually have around this, and there are certain criteria that you need to contribute to and have specific earnings and a number of insured hours of work and that sort of thing. So it's important that you go and take a look at their website in order to find out information on this. So it can be provided, this benefit, to someone who's the caregiver. It can also be spread throughout the family, so there can be several people who take this benefit and use it together. And it has to be taken for someone who has a significant risk of death within 26 weeks. And it can provide up to 26 weeks of benefit depending on when you access the resource. So I just thought I'd mention that because I feel it's a really important aspect of what's provided from a national level for patients, family members who want to take care of the patient. Now, I just thought I'd also highlight another area of the website that people find is extremely helpful about our symptom information that we have. So we frequently get asked about what kind of symptoms people can expect with advanced cancer, and that will depend on what type of cancer that you have, and also other illnesses that might be contributing to that. So our goal in palliative care is to diminish symptoms and also make quality of life better so that the person can live as best they can. And so when you're looking at symptoms, we have several articles about different symptoms, such as about sleep, about constipation, about nausea, about pain, so common symptoms that we do see at end of life, and it would be helpful for you to be able to access those. So I'm just wanting to mention them because, and I'm going to show you just one quick overview of one of our articles. That this one is on about pain. And, you know, all of our articles sort of have this common theme about addressing what is it, so what is the symptom, causes and sorting out that symptom, what you can do, so as a patient or family member, what you can do, use of medications for that specific symptom, other strategies that your healthcare team can do in terms of managing that symptom, and then other treatment options. So we're pretty extensive in terms of what we cover within each article about symptoms, and I think it's really helpful, and it's a really helpful piece of information for sometimes people to print out as they go to their healthcare team and say, you know, we've tried these 2 medications, but I'm wondering, would this one potentially work that's been mentioned here? So, you know, it's a really helpful tool to find more information and benefit from the information that's there, and then linking with your healthcare team appropriately. I am going to also talk about one article that or another set of articles that we have. Often people are wondering and trying to prepare about what might the final days of life look like, and especially if you haven't ever experienced the death of somebody close to you, or if you yourself are wondering sort of what symptoms might you anticipate in the final days of life. We do have several articles that sort of talk about what that might look like. Again, sometimes when people wonder about what's available, that will depend on the location of care where somebody is at. So one of our articles actually that we have on the website is talking about considerations for a home death. And sometimes people find that helpful just to go through and review, is this something that I would like? Does it make sense? What are the resources that are available around me? And then also just preparing for symptoms and changes that might happen. In palliative care, we're pretty good at trying to anticipate what to expect, and so we really do try to anticipate what might be ahead. One article that caregivers find particularly helpful is an article called When Death is Near, that just prepares them for the physical changes they might see when someone's dying. So I just highlight those. Sometimes people aren't sort of prepared for that in the initial stages of where they're at, but if that's something that you might find helpful, I just want to make sure that you know that it's available to you either now or in the future when you feel it might be helpful. Now I'm going to pass things over back to Ogechi.
Thank you, Simone. So now at this point in the presentation, what we'd like to do is really focus in on the resources available on Canadian Virtual Hospice. So again, we have a content of focus around information and support on living with advanced illness, palliative care, loss, and grief. And really throughout our presentation, what we've been talking about is a blend of that information. And you'd be able to go onto our website and access what information is relevant to you. And so taking a closer look at that, specifically for patients, we have a wealth of information just listed briefly right there under the image. We have topics, articles, which Simone has touched on a little bit. We have an Ask a Professional feature. We have Asked and Answered, which are frequently asked questions. We have connections to books, links, and other resources for patients. We have a Programs and Services area of our website. We have the gallery where the majority of our videos live, and we also have discussion forums, and in the following slides I'll review those a bit more closely. For families, similarly, we have a lot of the related information that's available for patients. There's a lot of crossover in the information, and then again some information that's more specific to family members and caregivers. And for professionals, we definitely have a lot of tools to support and inform their clinical practice in an area of the site called Tools for Practice. We also have an Ask a Professional feature that works for professionals that they have access to as well, and the gallery has lots of videos for our healthcare professionals out there working with individuals in advanced cancer or palliative care. And now just to talk a little bit more specifically about some of those resources. So again, the topics articles, Simone highlighted several of them that we have available for symptoms or financial assistance information or resources for caregivers. But really the topics articles are written by members of our interdisciplinary clinical team. So again, the physicians, clinical nurse specialists like myself and Simone, child grief experts, ethicists, pharmacists. We have content that we feel fills information gaps and is accessible in the topics article section of our site. So to get to that area of the site, you would simply just click the main green navigation tab that you can see there on the screen, highlighted topics. And from there, you'll see the banner which has a variety of categories available, and there's several articles within each category. So you can sort of hone in on what information is helpful for you and go through those available articles. All the information is very practical and reliable in the sense that it's evidence-based and based on research and literature, and hopefully it's information that can support you. And again, there's definitely a variety of topics available for you to access. So one of our main platforms of Canadian Virtual Hospice is our feature called Ask a Professional. And so really what this is Canadians are able to submit questions to our clinical team. So again, that diverse interdisciplinary clinical team. They can submit questions to us, and we provide confidential and personal responses with a promise of a 3-business-day turnaround time. And this resource is also available in French and in English, and it's available to all Canadians. And really what we're hoping to do is provide supportive information. These answers to questions are not meant to be an emergency resource, and it's not meant to guide specific medical care, but again, it's just providing supportive information that we hope is helpful. Next, we're going to talk about the Asked and Answered area of our website. And really, it's a profile of frequently asked questions received from the public, presented in question and answer format. So it sort of tackles what we feel are concerns and questions that come up over and over for patients, for families, for caregivers, and we sort of address it in a question and answer format on the Asked and Answered area of our site. To access this, you can go through the main orange support navigation tab on the homepage, and from there you can click the Asked and Answered tab. We also have an area called Books, Links, and More, which is represented by the icon that you can see there on the screen. And really what this is, it's a listing of various types of reliable resources on living with advanced illness, palliative care, loss, and grief. So you can go to Books, Links, and More. You can specifically pick a category of information that you're interested in and have access to a lot of resources that are highlighted there. We also have the Programs and Services area of our site, which is a really unique feature. It's an online listing of various local or regional or even national services. So someone would be able to click the icon for Programs and Services on our homepage. From there, they'd be directed to a map of Canada where they can sort of select their specific province and then again review a list of local or regional resources and services. So you'll have home care organizations listed there. You might have cancer organizations listed there, palliative care organizations listed there, etc. So again, it's a sort of hopefully a one-stop shop where you can go and access links to local services. So the next resource on our website to highlight is our discussion forums. And really, it sort of operates as a safe online space to connect with others, to sort of connect online with people who are going through similar experiences like yourself. It operates as a bit of a chat room forum where you can get peer-to-peer support. You'd have to create a username and password, then you'd have access to all of the existing conversation threads that are ongoing, or you could start a new conversation thread specific to what your needs are and engage with people through that platform. This discussion forum feature is moderated by one of the Canadian Virtual Hospice staff members just to sort of ensure there's a helpful presence and that the content is sort of appropriate and that people are sort of being supportive and helpful of one another and have someone to assist them if they have further needs, which would be our staff member. There's also the galleries, again, which is where the majority of our videos are highlighted. So the video we showed earlier from Dr. Susan McDonald is housed within the gallery section of our website. is found under the main orange navigation tab, which is listed as support. And from there, you would click on the gallery heading. An area of interest potentially for patients and families in the gallery are two sections. There's an area for illness and caregiving, which has a variety of videos that speak to those two areas. And then we also have a caregiving demonstration section of the website, which really sort of goes through, in short video clips, examples of providing hands-on caregiving care in the home. So, for example, repositioning someone in a bed, or perhaps helping someone get up from a lying down to a sitting position to a standing position. So we have examples of providing care in the home, videos that are demonstrating some of those aspects of care. As well, there's definitely an area for professionals within the gallery section of the website. So for our healthcare professionals out there who work with people with advanced cancer and who work with the palliative care population, there's definitely lots of videos for you to access in this area of the website as well. So we also have some new online tools that we launched in the fall of last year that we're very proud of, and we wanted to highlight very briefly just towards the end of our presentation with you today. So we have an online tool called mygrief.ca, and what this is, it's a free, interactive, web-based grief support, and it's available to Canadian citizens free of charge. This is just a sort of a screen grab of what you'll see, I believe, on the homepage of mygrief.ca, and really what it tries to do is go through different components of grief, different types of grief. There's video clips and text information to support someone who's gone through a loss, and hopefully to help them find better understanding of their emotions and what they're going through, and to also hear from people who have been through similar experiences of loss themselves. This is a tool that was developed by loss and grief experts, as well as family members who have gone through loss and grief, and so we hope it's a resource that sort of really meets the need of individuals. And again, it's called mygrief.ca. Another resource that we have is called livingmyculture.ca, and it's another web-based resource, and it's focused around culturally informed care for people living with advanced illness and for people going through palliative care. We spoke to a variety of individuals from 11 different cultural backgrounds, and they very openly shared with us some of their cultural perspectives in advanced illness, loss and grief, and palliative care. And on livingmyculture.ca, you can access all of these videos. This is a resource that might be helpful to our healthcare providers who work with people from a variety of different cultural backgrounds, just to get a little bit of insight and information into some of the features that people from different cultural backgrounds value in their care. The next tool is Indigenous Voices, and it really is sort of operating from the same lens of livingmyculture.ca, is to allow people who are involved with individuals from an Indigenous background to hear from them directly, sort of what they value in their care, what's important to them, around the components of advanced cancer, advanced illness, and palliative care. It's a variety of short video clips that are accessible when you go to Indigenous Voices, which actually lives on the livingmyculture.ca website. That's where you can go to access these video clips. And again, it's a video series and print materials based on stories of First Nations, Inuit, and Métis individuals about advanced illness and grief. It can be used as a supportive tool for Indigenous people to understand what quality palliative care is and to advocate for it, as well as an educative tool for healthcare providers. The last tool we'd like to highlight is another online resource called methadoneforpain.ca. It's a module-based learning tool on methadone. So this tool more speaks to our healthcare providers out there. Methadone is a medication that's absolutely used in advanced cancer and in the palliative care context. It's a tool or medication for pain management, often for neuropathic pain. It's not necessarily well understood by all people who sort of come into contact with it. So this is a resource that was developed by palliative care and advanced cancer experts to sort of help inform us about methadone. It was developed by leaders in pain management and specialists, and it's actually a free online course to all Canadians. So it's helpful for learners out there and those who will be prescribing medications, prescribing methadone specifically, as well as those who will be administering it and working with it. And that essentially brings us to the end of our presentation. We sort of have presented to you information that's available on Canadian Virtual Hospice, highlighted some of the resources that you can find when you access our website. Again, our content of focus is around living with advanced illness, palliative care, loss, and grief, and we've presented a blend of that information to you today. We really do hope that this information has been helpful to you and will sort of support you in wherever you are in dealing with advanced cancer, and we thank you so much for your time and attention.
Thank you so much, Ogechi and Simone, for facilitating our discussion today, and thank you everyone at home for joining us. I hope you found this presentation as helpful as I have. If someone you know is interested in watching this webcast, please direct them to CancerConnection.ca to view our complete on-demand library. If you're not already a member of our online community, I invite you to join us at CancerConnection.ca. Our community is a great place to connect with others and discuss your personal journey and other topics of interest, just like advanced cancer that we talked about today. Please take a moment to fill out our survey by clicking the clipboard icon on the bottom of your screen. Your feedback is very important to us, and it assists us with the development of future webcasts. Stay tuned to CancerConnection.ca for information about our upcoming webcasts, and we hope you'll join us again soon.